Hi, my name is Ixchel Velasco, and I'm going to talk about Bedaquiline microheteroresistance after cessation of tuberculosis treatment. Content: Definition, application, pros and cons, issue in Ecuador, and conclusion. Definition: Tuberculosis (TB) is a bacterial infection caused by a germ called Mycobacterium tuberculosis. The bacteria usually attack the lungs but can also damage other parts of the body. TB is spread through the air when a person with pulmonary TB coughs, sneezes, or speaks.
Tuberculosis can be resistant to one drug, to two drugs, or to more drugs. The more resistant your tuberculosis is, the greater the challenge it is to treat. One of the things that we at CDC have been part of in the last couple of years is reflected in a finding that one of our scientists published last year, and that is that a greater proportion of extensively drug-resistant tuberculosis is transmitted from person to person instead of having the drug resistance acquired over the course of therapy. That's an important finding, and it helps how we plan to identify and address XDR and MDR-TB moving forward.
Applications: Bedaquiline, marked under the brand name Certuro, is a medicine used to treat active tuberculosis. It is used specifically to treat multidrug-resistant tuberculosis when no other treatment can be used. It must be used together with at least 3 other medicines for tuberculosis.
A miracle drug to battle multi-drug resistant tuberculosis (MDR-TB) and extensively drug-resistant TB (XDR-TB) will be rolled out on Monday in 6 public hospitals across the country. This is part of a coordinated program between the government and Johnson & Johnson, whose pharma arm Janssen has manufactured the drug named Bedaquiline, trade name Certuro. The drug is perhaps the first in decades to have a potential to dramatically improve MDR-TB treatment outcomes and reduce the number of people who die from the disease. This is probably the first instance of a multinational partnering with the government to roll out a drug, and comes as the disease spreads alarmingly.
Pros and cons: Bedaquiline improves survival among persons with multidrug-resistant tuberculosis. Bedaquiline may cause side effects: articulation pain, headache, rash, excessive tiredness, loss of appetite, sickness, jaundice in the skin or eyes, dark color orange, pain in the upper right area of the stomach, fever, hemoptysis, chest pain.
एकदम स्टार्टिंग में मुझे 8 दवाई चालू थी और अभी मुझे पूरे दिन में 4 5 6 दवाई चालू है।
एक एमेटासिन का इंजेक्शन मुझे रोज़ 150 रुपीज़ का लेना पड़ता था। बाकी मेडिसिन भी काफ़ी महंगा था, तो ज़्यादातर मेरा खर्चा सैलरी वगैरह उसमें ही चला जाता था। यहाँ पे मुझे पूरा मेडिसिन फ्री मिल रहा है, और वो भी मेडिसिन ऐसा है जो बाहर अवेलेबल नहीं है, इंडिया में अवेलेबल नहीं है, तो यहाँ पे मुझे वो अवेलेबल हुआ और फ्री ऑफ कॉस्ट हुआ.
And because the patients which come to us are quite having very bad resistant profile, so you have to continue this bedaquiline delamine for almost 2 years, and the cost for this bedaquiline delamine for 4 courses, that is for 2 years, is really very expensive.
और एक ये रिक्वेस्ट है कि ये जो दवाइयाँ इतना डायमंड के भाव में दिया जा रहा है, ऐसे ना दें, ताकि जो हमारे जैसे लोग हैं वो कहाँ से अफोर्ड कर पाएंगे.
Due to which We are not able to provide this care to number of patients, so we have to limit our capacity.
With the new drugs, I would also like to say that yes, they help in the cure, but they also have less side effects. And the lesser the side effects, the more adherent a patient will be, the more likely he will finish that treatment. And if he finishes that treatment, the more likely he will achieve the cure. He will be cured of TB.
Issue in Ecuador. Ecuador is in fourth place with an estimate of 615 cases that corresponds to 19% of MDR patients of the total TB cases in the country. In Ecuador, cases of rifampicin-resistant RR and multidrug resistant MDR tuberculosis have increased in the last years with a minimum of 95 cases in 2013 and 233 cases in 2017. Conclusion. The emergence of RV0678 variants after completion of 6 months of bedaquiline treatment shows the risk of resistant amplification after cessation of treatment with a drug that has a long half-life, 5.5 months for bedaquiline.
Tuberculosis can be resistant to one drug, to two drugs, or to more drugs. The more resistant your tuberculosis is, the greater the challenge it is to
The report looks at TB, but it particularly focuses on the aspect of drug-resistant TB. It looks at the scale of the problem, it also looks at solutions to the problem, and focuses at the macro level at the impact on GDP, but also very much at the micro level on the impact, the economic impact on patients and their families and households.
There is a very significant gap between the resources required to tackle drug-resistant TB and what is actually being invested. And frankly, as someone with a background as an economist, it doesn't make sense not to invest because the problem is not going to get cheaper. The problem is going to get more expensive and cost more lives.
What I like about the report is for the first time it brings together the range of evidence on drug-resistant TB, both on its economic and health impacts. We know that governments in low and middle income countries have limited resources to invest in their healthcare system. This report provides them with the evidence they need to begin to consider investing in drug-resistant TB. The actual savings we could make to the economy from reducing drug-resistant TB more than cover the costs of the whole TB epidemic.
That to me is a good investment, not to mention that we're actually saving lives.
We can win this, but it requires more innovation, more collaboration between the different partners, really rigorous execution. It does require more money, but above all else, it requires political leadership and commitment.